Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to ISNA's Friday Reflections. Sorry we got a little delayed because of some technical difficulty, but inshallah we will start now. Today our guest speaker is Dr. Nabile Safdar. Dr. Nabile Safdar is the president of the Islamic Medical Association of North America, IMANA. He is serving on the steering committee of the National Muslim Task Force on COVID-19 along with ISNA. Dr. Safdar is a professor at Emory Healthcare, where he serves as the Associate Chief Medical Information Officer and the chair of the Analytics Advisory Council. Please welcome Dr. Nabile Safdar.
Thank you, Basharat. Assalamu alaikum, everyone. My name is Nabile Safdar, and I'm so happy to be with you all today. Thank you to ISNA for organizing this Friday Reflection Series. I think it's been a source of information and conversation in the community for us. We're going to talk a little bit today about the impact of COVID-19 in the American Muslim community. And this has been a time which has been challenging for us. It's also been a time where we've seen many great strengths arise and some opportunities for collaboration. So let me start by talking about those a little bit. First of all, Alhamdulillah, we are in a position as Muslims that we have no conflict with the public health guidance, the public health policies in general, and with seeking medical care. And that's been a source of strength for us because we know within our tradition, we are told to seek medical treatment because Allah subhanahu wa ta'ala has not created any illness without creating a cure for it. And that's a source of hope and inspiration for us. We also know that our healthcare providers on the front lines have been risking a lot for the cause of being able to save lives. And it is a source of consolation and reassurance to them, inshallah, that what it says in the Quran 5:32, that if anyone saves a life, it would be as if he saved all the lives of all mankind. So alhamdulillah, those are sources of inspiration for us and sources of strength. We also know that there have been really important contributions that Muslims have made to the bigger story in terms of solving, inshallah, and addressing this challenge of COVID-19. And we've seen on a local level, a national level, and an international level, some of those strengths and those successes. You know, it's not lost on us, and it shouldn't be lost on us, that variolation is a practice that was common in Africa, in the Middle East, and in Asia through a lot of Muslim societies historically that helped prevent diseases like smallpox. This was a practice where people would take sometimes a little bit of fluid from a smallpox wound and inoculate others to prevent the worst of that disease. And now the leaders of some of the most effective vaccines, the BioNTech and Pfizer vaccine, are Dr. Sahin and Turechi. And I'm going to share a picture of them here in just a minute so that you can see who I'm talking about. So I'm going to share my screen. And that will pop up momentarily. But I want you to see the faces of some of the most highly recognized Muslim contributions to solving the pandemic. And this is a source of inspiration, and we thank them for their contributions. But it's not just those that make the headlines. We've all seen that through WhatsApp groups, email listservs, other forms of communication, we've seen in cities around the country that there have been sources of opportunities for collaboration between leaders in the community, those in the masjid leadership, those in nonprofit leadership who are now collaborating, asking each other for advice, taking each other's counsel and shura, and being able to help come up with common policies and procedures so that one masjid, for example, can learn from the best practices and examples of another. We've even seen cases where this has happened across different cities, and we've seen some organizations pop up that have helped solve this and address these issues nationally. But let's first just level set. Where are we in the pandemic right now? The Muslim community is no different than the rest of the larger community when it comes to being affected by COVID-19. There may be actually some unique challenges that the Muslim community has, and we'll talk about those as well. But we still have nearly every geographic area showing a high level of community transmission. It is decreasing, but this is no time for us to let up on what we know is going to be the basics of preventing the transmission of COVID-19. Wearing masks, social distancing, limiting the size of large gathering, and practicing good hand hygiene. I want to emphasize that these are things which are consistent with our tradition. It's consistent with good public health guidance. And inshallah, I want to encourage all of you. I know it's tiring. I know it's difficult to continue these practices. Continuing these practices is what's going to allow us to continue to see, inshallah, the precipitous drop we've seen in the last few weeks in new cases and deaths. We're still not out of the woods. So although we see new cases dropping rapidly and we see reported deaths by day dropping rapidly, we're still at levels which are higher than the surges we saw at last spring and last summer. And we're still seeing a strain on the healthcare setting. So this is good news. Inshallah, may this continue. But we're still not out of the woods. Even though the number of hospitalized patients by COVID-19 are decreasing, the numbers are still very high. And I think many of us have experienced and seen the announcements of deaths, the janazas, the families that were not able to be with their loved one as their loved one is in the hospital. There are people that I know personally right now that are in the situation where their loved one, their mother, their father are in the hospital and they're not able to visit them directly. So I want to emphasize again that this is an ongoing challenge. We're optimistic that inshallah it's getting better, but for those that are involved, that those that are currently suffering from this, it doesn't really matter what the numbers show. What matters to them is the real human impact it's having on their families, their friends, their loved ones, their ability to see each other, and their, in some cases, inability to see their loved ones again, because there have been a lot of people that have died. In the United States, about 1 in 600 people, and in some populations, it's been higher than that. Alhamdulillah, thank God, we do have currently 2 vaccines authorized for use in the United States, the Pfizer-BioNTech and the Moderna vaccines. Inshallah, there will be more coming soon. And we'll talk a little bit about these. Current pace, if the current pace of vaccinations continues, then the projections are that approximately 70% of the US population will be vaccinated by the fall in September, and possibly about 90% by roughly Thanksgiving. Geez, that would be great, because 70% is the lower margin of what experts consider to be where herd immunity could start to kick in. And if that's the truth, and if we reach 90%, even better. But we have a long ways to go. The vaccine rollout has been very uneven. It is managed at the state level typically. It has been very uneven from state to state. It's been very uneven within states. Although providers are now administering about 1.6 million doses per day on average, that just still leaves a lot more work to do. And we know that there are challenges getting access to these vaccines. We know that there are challenges for the Muslim community. So I want to talk about those challenges a little bit more. The issues that we're dealing with in the Muslim community in some ways are the same issues that the whole nation has been dealing with and struggling with when it comes to COVID-19 and healthcare in general. And I want to mention these specifically. Systemic racism is a health emergency. Systemic racism is contributing to our inability to make sure that the vaccinations are evenly distributed and fairly distributed. We'll talk a little bit more about that. There are problems with accessing healthcare, which are exacerbated by systemic racism, but are endemic in all communities, or many communities, I should say, in the United States, and those continue to be a challenge. The mental health toll of this pandemic has been incredible. There's a lot of anxiety. There are a lot of issues with mental health, and people are struggling. And that's a challenge that we're seeing in the Muslim community, of course, as well. And frankly, we in the Muslim community are just as susceptible to misinformation or disinformation as the larger community. In fact, we've in some cases excelled at creating our own channels of misinformation or disinformation in the Muslim community. So let's talk about these things for just a few minutes. I want to call out the efforts of the Muslim Anti-Racism Committee, led by Sister Marguerite Hill, and the Muslim Wellness Foundation, led by Dr. Kamila Rashad, who put together the National Black Muslim COVID Coalition and been addressing the issues of systemic racism, educating others, and addressing these issues specifically as it applies to the Black community in the United States. And why, for some of you, you may be this may be your first exposure to this idea. For others, this is a conversation that you're very familiar with and you know a lot about. But here's the truth. If you go to their websites, you'll find that there is a disproportionate rate of Black Americans infected and dying due to coronavirus. The statistics around this are really well recognized. This has been true even in last spring and summer. This was being recognized. The numbers of hospitalizations and death rates amongst Black Americans and Brown Americans are higher than amongst white Americans, in some cases several times higher. If we look at the risk of hospitalization and death, if we look at the current vaccination rates in the African American community, there is a consistent pattern. The consistent pattern is the percent of vaccinations that are being administered are lower proportionally than the proportion of African Americans, Indigenous Americans, and other minorities as represented in the percent of the population. And this is affecting our Muslim community. This is something that is a challenge for us as well. So we need to amplify the efforts and support the efforts of these organizations because this is an issue for us. Mental health has been such a challenge during this pandemic. In one point in this local area where I work, the Children's Hospital had more children admitted to the hospital who had attempted suicide or tried to harm themselves than there were children who were being treated for COVID. It has also affected the elderly disproportionately. And there are challenges that our community faces when it comes to getting good treatment and good access to mental health care. So I want to call to your attention the efforts of a lot of organizations who specialize in this area, whether it's the Muslim Wellness Foundation, the Institute for Muslim Mental Health, The FYI, our friends at AMHP or webinars done by organizations like Imana, there are resources available to you, but this is a challenge, particularly for the Muslim community, where culturally competent care has not always been easily accessible. And inshallah, we'll do better at being able to provide resources for that as time goes on. Misinformation has been a big issue, and we're going to close this session soon, but there are a couple of key points that I would like to get out. Vaccines save lives. Yes, there are some risks, but the benefits far outweigh those risks. The benefits are reducing deaths and severe disease. The risks are often associated with allergic reactions. And in this case, these vaccines have proven overwhelmingly safe. The rate of allergic reactions has been very low. And because we know what that rate is, there are precautions taken at the time of vaccination to be able to monitor people so that we can avoid them. That's number one. These vaccines are safe and they're effective. Number two, the vaccines available in the United States are halal. There is no objectionable ingredient in the 2 vaccines that are currently authorized for use in the United States, nor any objectionable processes. As other vaccines become authorized, we will have our partners who are part of the National Muslim Task Force through the Fiqh Council of North America, the American Muslim Jurists Associations, and others evaluate those and be a trusted source for us to evaluate the permissibility. But overall, we know that the vaccines are halal, they work, they're safe, and they are effective. If you are eligible to get a vaccine, do it. It is, in my opinion, not only for your own safety, for your own family safety, but it is a public good, and may Allah reward you for it. If you have questions about vaccines, there are resources available provided by organizations like the Islamic Medical Association of North America and also the task force, which has published a lot of this information. Look them up. There are a lot of webinars available. So we need to continue to do our best to fight disinformation, to fight misinformation. We understand that there is hesitancy about vaccines, in some cases for legitimate reasons, particularly in those communities where there's may have been historical reasons for a distrust of the healthcare community. You know, in particular in the African American community, there is a recent memory of the Tuskegee experiments, for example, which has sown distrust, and I understand that. But in this case, these vaccines are effective and they're halal. I feel comfortable saying that, and I feel that we need to get that word out. And finally, access continues to be an issue. We know that there are transportation issues, there are insurance issues, there is a digital divide. And we may sometimes think that, hey, in the Muslim community, aren't there more physicians, nurses, pharmacists? And that's true. In healthcare, Muslims are overrepresented compared to our proportion in the population in general. However, there are also portions of our community that have less access than the general community. Now, that may be because of language barriers. It may be because of a challenge with insurance. It may be with transportation issues or the digital divide that I mentioned. So there are great successes that we have been able to highlight. I've seen more collaboration than we've ever seen before between different organizations at the local and the national level, and even the international level. We are inspired by those healthcare workers and those that developed the vaccine from BioNTech. But we also need to recognize our challenges. And inshallah, as we are less than 2 months away from Ramadan, let's maintain our self-care, maintain our dedication, maintain our energy levels, because this is a long haul challenge for us to be able to continue to socially distance, wear masks, and seek Allah's protection from this pandemic. Thank you all for your attention. I hope this has been helpful. May Allah reward you all, and thank you for ISNA's arrangement of this forum. Thank you. Assalamu alaikum.
Jazakallahu khairan. Thank you so much, Dr. Nabile, for your time today. MashaAllah, this important information that you shared with everybody. I'm sure everybody will benefit from it. It has been a very difficult year for all of us. It's been, more than a year now. But alhamdulillah, many developments are happening. We have the vaccine. About 52 million Americans have already been vaccinated. So alhamdulillah. But we have to continue to take precautions and continue to be careful in this pandemic. Inshallah, ISNA will continue its online programming as we have been doing throughout this year. We have an upcoming education forum. This is a forum for teachers, administrators, principals. We recently held one education forum, which is called the West Coast Education Forum. Obviously, it was virtual. We had about 600 participants that took part in that event. So this next one is going to be on April 3rd and 4th. So please visit our website, isna.net. All the information and program details are given there. Register, inshallah, for this event. And take care, stay safe. Assalamu alaikum wa rahmatullahi wa barakatuh.